International Overdose Awareness Day is always a bittersweet event. There's a lot of grief that we as a community feel as people who love people who use drugs, as people who have loved people who have lost their lives to poor drug policy. There's a lot of grief, I think, leading up to this day, and that is expressed on this day. And so having an outlet for that is nice, because a lot of times that grief is often ignored or shoved down or not as valued as some other grief. So it's nice to be able to come together as a community and be able to express that and be able to grieve together. It's also nice to see so many people invested in the issue and who have an understanding of what is leading to these issues, such as poor drug policy, such as, all of the levels of government refusing to, or their inability to act in ways that we need to, regarding housing, regarding basic human rights, regarding social services that would really address the current crisis that we're experiencing. It sometimes can be really isolating, and so it's nice to be able to connect with people. But the fact that we're connecting over all of these lost lives is heartbreaking. So like I said, it's bittersweet. Hopefully with the Minister Sachs, we will be able to elevate some of the issues that we're experiencing. So that's really exciting. We're really grateful for her presence here and the exposure. And I think there's hope that's coming out of that, but it's always a somber day. We need a safe consumption site as a bare minimum first step. We need a space so that people can use in ways that will provide them safety and connect them to all of the other services that they need. But we need those services as well. Like, we need the safe consumption site, but we also need access to housing. We need access to medical supports for people. We need access to mental health treatment. We need access to social supports and life skills, and we really just need to be investing in community when it comes to all resources, financial resources and others as well. So I'm not sure, it's really disappointing. I'm not sure if the mayor has officially made any statements in his current role. And so I'm not sure where his support lies or where it doesn't lie at this point when it comes to a supervised consumption site. But at a bare minimum, we need that so that we can build up the rest of the services, because people cannot get better if they're not here. And also, we really need to be focusing and shifting the narrative to the poor drug policy that's leading to this. We need safer supply. There are people that use opiates and opioids for all sorts of things who are not dying at the same rates, and it's because of how we treat people who use or access drugs from certain places. And so we really need to change our mindset on how people are allowed to use drugs, how people are allowed to access the medicines that they need to get better, to get well, and we need to provide the services that those drugs are often in place of. And also, there are lots of drugs that we allow freely for people to use in our society. Marijuana was treated very poorly. People were jailed for very long periods of time for possession and use of marijuana, and within the last 10 years we've seen a huge change. There are dispensaries all over the place. The world has not fallen apart. People have not, it's not this gateway drug that is leading to the deaths of all of these people. And I think that we can do that with maybe not all of the things that we're seeing, but shifting our mindset around how people are accessing drugs and recognizing that that is a big part of what's causing this problem is what's really needed for this. The Gilbert Centre is a huge organization that offers a variety of services for people who are often isolated from community for different reasons. So we have HIV programming, we have 2S LGBTQ programming, we have some educational programming, and then I work in the harm reduction department. And so our harm reduction department has expanded considerably in the last couple of years to really address some of the gaps that we're seeing in the community. We don't provide clinical services, but we provide referrals to people to what it is that they need. As a core, we provide harm reduction traditional, I guess, pieces. So we offer unused drug use equipment so that we are able to connect people to the equipment that they need to reduce the potential physical harms. We have naloxone that's offered to anyone in community who needs it, whether they're using drugs, know someone who's using drugs, or just are concerned about it potentially. We can offer training for those sorts of things. We're currently running a cooling center, so people who are not able to or don't really have space during the day to just exist and be, they can come in and use our services. We have phones available, we have computers that people can access, as well as clothing and food stock, all of which are clothing and food, all of which are based on donations for the most part, except for this small cooling center that we've been providing. But after that, when we go back to our regular programming, we will still be providing those services, and it's all based on community support. And then we also just provide a space for people to be, where they're not expected to be working necessarily towards a goal, or that they're not on their way to some next big thing. It just gives them a space to be without shame, without fear of being in trouble for the fact that they use drugs or that they may have used drugs. And I think that really allows people to start to work on what their goals are, start to work on what their next steps are, because they can just be themselves.